If you're under 50 and you go to the doctor right now with a new lump, persistent fatigue, or blood in your stool, there is a terrifying high chance your symptoms will be dismissed. We have always been told that cancer is a disease of aging, something that develops slowly after decades of living your life. But a massive recent global study just revealed that cancer rates in adults under 50 have skyrocketed by 79% over the past 3 decades. Colorectal, breast, and pancreatic cancers are now regularly striking people in their 20s and 30s. But here's the part that should concern you the most. When young people get cancer today, it is almost always diagnosed dangerously late. Not because the cancer was hiding, but because no one thought to look. Because doctors often assume you're too young for cancer, thousands of young people are shifting from a highly curable stage to a deadly one. Today, I'm going to show you exactly why this global spike is happening, the specific symptoms you might be ignoring right now, why cancer in your 30s is biologically different than cancer in your 70s, and the exact words you need to say to your doctor so you do not become a statistic. This is something I'm seeing regularly in my own clinical practice. The assumption that youth equals immunity has broken down completely. In 2023, a landmark study published by BMJ Oncology analyzed global data and confirmed the 79% increase in early-onset cancer. I need you to understand that this is not minor fluctuation, it is not a statistical artifact, and most importantly, it is not just happening because our screening technology has gotten better. More young people are genuinely getting sick. The two most alarming increases are in colorectal and breast cancer. Colorectal cancer incidence in adults under 50 has literally doubled since the mid-1990s across several high-income countries. The violent spike is precisely why the American Cancer Society made the unprecedented decisions in 2018 to lower recommended screening age from 50 down to 45. That was not a routine update. It was a blaring alarm bell in response to a dangerous trend that the medical community could no longer ignore. Simultaneously, breast cancer in women under 40 is steadily climbing. We are seeing pancreatic, kidney, and gastric cancers showing up decades earlier than expected. So what is actually driving this? Here's where most people get the picture completely wrong. Many assume that if a 30-year-old gets cancer, it must be genetic. They think, I have no family history, so I am safe. The assumption is incredibly dangerous. The vast majority of early-onset cancers develop in people with absolutely zero family history that they know and no inherited mutation like BRCA1 or BRCA2. Instead, researchers point to the exposome, the combination of environmental and metabolic factors we're exposed to throughout our lives. While we do not have one single definitive answer yet, the scientific community is heavily investigating several modern culprits. First, obesity and metabolic syndrome are developing far earlier in life, putting young bodies in a constant state of low-grade inflammation. Second, the consumption of ultra-processed foods starting in early childhood is fundamentally altering our cellular health. Third, microplastics and endocrine disrupting chemicals found in our water and food packaging are under intense active investigation. And fourth, sweeping changes in the human gut microbiome driven by modern diets and antibiotic use seem to be weakening our natural immune defenses. We are even studying exposures that happen to a fetus before birth as potential seeds for early-onset cancer later in life. The trend is real. It is well documented and is accelerating, but why are these cases so frequently turning fatal? In cancer care, we have a saying, time is biology and biology determines your outcome. A delayed diagnosis gives cancer more time to grow, more time to mutate, more time to spread into other organs, and more time to shift from a curable stage to a highly complicated terminal one. When colorectal cancer is discovered at stage 1 or 2, about 90% of patients will survive long term. But when the exact same cancer is caught at stage 4, the long-term survival rate plummets to just 15%. And right now, two forces are colliding to create fatal delays in young people. The first force is the patients themselves. Young adults are consumed with building their lives. They're launching careers, raising toddlers, and managing tight budgets. If a 28-year-old loses weight, they praise their new diet. If a 35-year-old is exhausted, they blame their newborn baby. If they see blood in the stool, they assume it is hemorrhoid from stress. Possibility of cancer simply does not cross their mind. But the second, far more dangerous force comes from the medical system. It is a well-documented clinical blind spot known as age bias in diagnosis. Major outlets like the New York Times recently surveyed hundreds of young cancer patients. The pattern they uncovered was deeply disturbing. Patient after patient reporting symptoms that were casually dismissed because they were considered too young. We see it in clinical practice all the time. Take, for example, a typical 25-year-old complaining of severe fatigue and blood in the stool. For years, multiple medical providers might blame his symptoms on college stress, poor diet, or anxiety. No one looks deeper until he ends up in the emergency room with an obstructed colon, ultimately diagnosed with advanced colon cancer. Or consider a 28-year-old woman who discovers a distinct lump in her breast. It can take some time, up to 6 months of appointments, to finally get a biopsy, simply because multiple doctors assure her that cancer is extremely unlikely at her age. Here's the clinical reality every single person needs to memorize. Screening guidelines are population-level tools. They're built around average risk. They do not mean you're magically immune to disease before your 45th birthday. If a physician tells you that you're too young to worry about a persistent symptom, remember this. That statement is an assumption about probability. It is not a diagnosis. But missed diagnoses are not the only problem. The scientific community is currently uncovering a terrifying reality about the disease itself. Cancers that develop in younger patients are often biologically different from the exact same cancers diagnosed in older patients. When a younger adult gets colorectal cancer, it tends to present at a more advanced stage and show much more aggressive, hostile features under a microscope. It is more frequently located on the left side of the colon, and it often carries distinct molecular and genetic characteristics that make it harder to treat. Similarly, breast cancer in younger women is significantly more likely to be classified as hormone receptor negative or triple negative. These are aggressive cancer subtypes that move fast and are notoriously difficult to treat effectively. We're beginning to realize that the age at which cancer is diagnosed may actually function as a biological variable. The youth of the patient's immune system might fundamentally change how the cancer behaves, meaning we cannot just copy and paste treatments from 70-year-olds onto 30-year-olds and expect the same results. When you combine aggressive biology with delayed diagnosis, you get a devastating physical outcome. But surviving the tumor is only half the battle. The lived experience of having cancer under 50 is a completely different reality compared to cancer later in life. It shatters a young person's world across 5 different dimensions. Number 1, the devastating impact on fertility. Many standard treatments like chemotherapy, pelvic radiation, and long-term hormone blockers may permanently destroy reproductive function. Older patients have already built their families. Young patients, however, are faced with urgent, deeply traumatic decisions about egg freezing or sperm banking, often within only days to spare before chemo begins. Imagine a young woman in her mid-30s who has spent years actively trying to conceive, only to receive a cancer diagnosis. Her oncologist might prescribe 5 years of continuous hormone blocking therapy, making pregnancy very difficult during that entire half decade. Many young patients describe this forced delay as feeling like receiving a second life-altering diagnosis right on top of the first. Tragically, many are not even told that fertility preservation is an option before chemotherapy until the window has already closed. Number 2, sudden financial toxicity. Older patients often have decades of savings, home equity, Medicare, and career stability. Young patients are early in their careers, carrying student debt and trying to build a foundation. Picture a 32-year-old who just emptied his savings to buy his first home, suddenly diagnosed with a rare cancer. His spouse might have to quit her job to become his full-time caregiver. They may have to travel across the country for clinical trials. The crushing guilt of imagining leaving behind a young family buried in medical debt is suffocating. Cancer is the leading single cause of medical bankruptcy in America, and young adults bear the absolute brunt of it. Number 3, the disruption of identity. A cancer diagnosis at 25 or 35 interrupts the core question of young adulthood. Who am I becoming in this world? For a young woman, losing their hair, understanding surgery, and entering medically induced menopause can feel like a perfect storm that erases her sense of self at the exact moment she should be at her peak. For a young professional just stepping into their dream career, losing physical stamina or cognitive sharpness can permanently derail the life they were building. Number 4, the myth of the cure. Society assumes that when cancer treatment ends, your life simply goes back to normal. But for young adults, the long-term effects of surviving are brutal. A 30-year-old survival might face 50 years of managing lymphedema, peripheral neuropathy, cognitive brain fog, or chronic fatigue. Breast cancer induced premature menopause, leading to severe joint pain and progressive osteoporosis for decades. The person they were before the diagnosis is gone. They have to build an entirely new identity from scratch. And number 5, the silent caregivers. We rarely talk about the spouses and partners in their 20s and 30s who suddenly become full-time oncology nurses. A young husband might find himself navigating his wife's cancer diagnosis during her pregnancy, adding an unimaginable layer of complexity to what should be a joyful time. Emotional and physical weight placed on young partners is enormous, and the support systems available to them are virtually non-existent. I do not share these statistics and scenarios to paralyze you with fear. I share them so you can arm yourself. If you take away anything from this video, let it be these actionable steps. First, know your body and refuse to be dismissed. If a symptom like unexplained weight loss, changes in bowel habits, or a new lump persists for more than 3 weeks, demand an evaluation. If a doctor tells you that you're too young, you look them in the eye and say, I understand it is statistically unlikely, but I want the diagnostic testing done to rule it out completely. Second, interrogate your family tree. Know your complete family history and share every detail with your doctor. If any relative had cancer at a young age, you might qualify for earlier screening. Conditions like Lynch syndrome significantly raise your lifetime risk for colorectal, uterine, and ovarian cancer, but you can only test for it if you know to look. Third, if you or a loved one receives a diagnosis, ask 3 questions immediately. What are my fertility preservation options, and can we do them before treatment starts? Does this hospital have a medical navigator or social worker to help me protect my assets? What specific psychological resources do you have for young adults? Do not fight this alone. Look into organizations specifically designed for young patients, like First Descent, the Young Survival Coalition, and Man Up to Cancer. Cancer in younger people is rising globally, and science is racing to understand exactly why. But what we already know is that missed diagnoses are the biggest, most preventable tragedies happening right now. While the data shows a dark pattern of dismissal and delayed treatment, the reality on the ground also contains something fiercely powerful and genuinely hopeful. The 25-year-old who was dismissed for years by doctors can eventually find the right care, recover, and go on to get married. The young patient who was told they might never walk again, can eventually travel the world with their partner. And the young woman who endures years of forced medical menopause can eventually hold a newborn baby in her arms, knowing every single moment of the fight was worth it. If you're under 50 and something does not feel right inside your body, do not wait, and do not ever let your age become the reason you are dismissed. If this video helped you understand this blind spot in our medical system, please subscribe to the channel for more evidence-based medical information. And if you want to understand how overall cancer survival rates have actually drastically improved over the past decade, I cover that important, hopeful topic in the video right here on your screen.